My name is Dr. D. I'm one of the bro founders here at I Can Be. Today, I'm excited to break down some HR stuff for you. Don't worry, I promise to make it fun and interactive. First, let's go on a quick journey down memory lane. My brother and I started the Beehive back in 2015 in the vibrant San Fernando Valley. Like many businesses, we started small. Our first office, Van Nuys in 2015. Fast forward to 2017, we flew over to Orange County, and by 2021, we buzzed our way to the Inland Empire. Today, we probably serve hundreds of families across Southern California. We're all about providing behavioral analytics services to children and individuals with autism and other related disabilities. We don't stop there. Our mission at I Can Be is to create amazing experiences to our clients and our staff. By the way, BZBs. So who are the BZBs making all this magic happen? Our clinical model is composed of dedicated behavior technicians, case managers, BCBAs, and our wonderful lead BCBAs. Plus, we have regional directors managing our eastern and western regions and an executive director overseeing it all. But that's not all. Our team is rounded by an amazing administrative crew. Think office administrators, schedulers, claims, credentialing reps, and of course, our incredible recruiters. And remember, our HR department is always there to help you whenever you need assistance. Where do we serve our clients, you might ask? In the home, at schools, and within community settings. Sessions usually last 2 to 3 hours, and if you're working in a school, those can go up to 5 to 6 hours. BCBs indeed. Now, let's chat about 5 core values that guide our services. Be client first. Be excellent. Be fun. Be a teammate. Be ethical. Do you have aspirations in ABA? Great news! I Can Be partners with National University for those interested in pursuing that degree in ABA. Reach out to HR if you want more info about that. Your education matters to us. At I Can Be, your voice matters. We value your ideas and suggestions, which is why we conduct regular check-ins through surveys and meetings. We want to ensure the Beehive is always buzzing with positivity. We also use QuickBooks and CentralReach for our clinical administrative needs. You'll be getting more information on these platforms soon, so stay tuned. Don't forget to follow us on Instagram, Facebook, and TikTok to stay connected. We also have our own clinical channel called ABA with Dr. D, where you can find resources and answers to your clinical questions. Once again, welcome to the Beehive. We're so excited to get to know you, and here's a fun little tidbit. At the Beehive, we call all our staff members BCBs. So congrats, you're officially a BCB now. Hello and welcome to I Can Be. We're so excited to have you join our family. Today, we're going to walk you through some essential information to help us get you started on the right foot. So let's dive right into it. Here's what we're going to cover in today's agenda. Welcome and introductions, company policies, mandate reporting refresher, HIPAA and FERPA overview, admin and clinical team contact information, CentralReach modules. First up, a warm welcome. At I Can Be, we believe in teamwork and collaboration. Each of you brings unique skills and experiences that will enhance our mission. Let's take a moment to introduce ourselves. Now, let's go over some important company policies that every team member must know. First, we have the dress code. We want everyone to feel comfortable while maintaining a professional appearance. Please ensure your attire aligns with our guidelines. Next, let's talk about scheduling availability. We understand life can be busy, and we're committed to flexibility. However, it's essential to communicate your availability with your supervisor. Don't forget about drive time and mileage. Log your travel accurately to ensure compensation for your commuting expenses. If you need to cancel or request time off, please follow the appropriate procedures. It's important to submit requests in a timely manner to help us manage our schedules effectively. Regarding our sick policy, we encourage you to take care of your health. If you're unwell, notify your supervisor and make sure to follow the guidelines for sick leave. Now let's discuss payroll and pay dates. Make sure you understand our payroll schedule and keep an eye on pay dates so you're well informed about your compensation. Moving on to mandated reporting. It's crucial for us to be aware of our responsibilities when it comes to reporting cases of abuse and neglect. Please review our policies thoroughly. Speaking of policies, let's quickly touch on HIPAA and FERPA. Protecting client information is our top priority. Ensure you keep these regulations at the forefront in your work. Next, make note of our admin and clinical team contact information. You'll find this helpful to reach out when you need assistance or guidance. Finally, we'll be using CentralReach for data and client management. Please take the time to familiarize yourself with the various modules available. Alright, that wraps up our overview of I Can Be. We're thrilled to have you on board and can't wait to see you thrive in our community. Remember, if you have any questions, don't hesitate to reach out. Welcome again to I Can Be, where together we can make a difference. Understanding at-will employment at I Can Be. At I Can Be, all personnel are employed on an at-will basis. But what does that really mean? Employment at will means that either you, the employee, or I Can Be can terminate the employment relationship at any time. This can happen with or without cause and with or without advance notice. You'll find the details regarding at-will employment in your employment offer letter. This is an important document outlining your relationship with I Can Be. It's important to emphasize that nothing in this training course or any other communication is meant to restrict the at will nature of your employment. This flexibility is a fundamental part of our employment culture. Now you might have questions about employment agreements or contracts. We want to make it clear that no manager, supervisor, or other employee at ICANN have the authority to create an agreement for employment for a specific time frame or under different terms than the at-will policy. Only two individuals have this authority, and that's Dr. Jose Davila, myself, Chief Clinical Director, and Juan Davila, our Director of Operations. Remember that any alteration of this at-will employment status requires a written agreement signed by either Dr. Davila or Juan Davila to be binding. Finally, we want you to feel empowered. At ICANN, nothing in our at-will statement is intended to interfere with your rights. You have the right to communicate with colleagues or work towards altering the terms and conditions of your employment if you wish. Thank you for understanding our at-will employment policy. If you have any questions, reach out to HR. Together, we can create a positive work environment for everyone. Hey everyone, welcome back. We're going to dive into a super important topic that can make a difference in our professional environment, and that's dress code. Let's kick things off with what you should wear. First up, let's talk about what you should wear. Comfort and professionalism go hand in hand, so here are a few key points. Closed-toe shoes and flat shoes. Opt for closed-toe or flat shoes. They're safe and keep you comfy, whether you're on your feet or running around. Movable clothing. Wear clothes that allow you to move around easily. Flexibility is key. Clean and presentable. Remember, clothing should always be clean and presentable. A polished appearance shows respect for your role and those around you. ICANN issue shirts. During social skills sessions and field trips, you'll want to sport your ICANN issue shirt. It fosters a sense of unity and professionalism. Well-groomed staff. Make sure to stay well-groomed. When you look good, you feel good, and it shows. Small, inexpensive jewelry. Keep your accessories minimal. Opt for small, inexpensive jewelry pieces that add a touch of personal style without being distracting. Say no to heels and flip-flops or slides. They can be unsafe in active environments and don't convey professionalism. Fitting attire is essential, but avoid see-through or excessively tight clothing. We want to maintain a respectful atmosphere. Clothes that show too much skin, like crop tops or sagging pants, should be left at home. We want to keep it professional. Avoid clothing with profanity or any religious or political statements. It's best to keep the focus on the work at hand. While self-expression is important, be mindful of any tattoos that may be offensive. Skip large earrings or dangling jewelry. We want to ensure safety and avoid distractions while working. Finally, please avoid wearing designer items. It's easy to get dirty when you're engaged in activities, so let's keep it practical. Before we wrap it up, there's one last topic: scents and odors. At ICANN, we want to maintain a pleasant environment for everyone. Strong scents, disruptive odors, or allergy-inducing smells like overpowering perfumes, smoke, or food items are a no-go. Let's be respectful and mindful of our clients, co-workers, and anyone we might encounter during our sessions. We hope this overview of the dress code helps you feel prepared and confident. Remember, when in doubt, offer comfort, professionalism, and respect for those around you. Thanks for tuning in. We'll see you in the next segment. Hello, BZBs. We're going to go over some important communication practices that will help us stay connected, efficient, and professional throughout our workday. First off, let's talk about checking your messages. It's essential that all BZBs periodically check their emails, workplace messages, and mobile devices throughout the workday. This helps ensure you don't miss any updates or important information shared by your colleagues. Remember, this should not be done while you're with your clients. Focus on providing them with your undivided attention during those interactions. When you do receive messages, aim to respond to all emails, texts, and workplace messages within one business day. Being responsive shows your team that you value their communication. Now let's discuss the nature of responses. Even though you might be in a casual work environment, it's important to keep your responses professional. And while we're on the topic of responses, please be cautious with the reply all function. Only use it if your response is relevant to everyone in that email thread. This helps keep our communication concise and effective. When sending an email, especially to anyone in the admin or clinical team, make sure your subject line is clear and descriptive. This sets a tone for the message and allows recipients to understand the content right away. And please avoid using old threads to discuss new topics. It can cause confusion and make it harder for your team to keep track of ongoing conversations. By following these communication guidelines, we can foster a more productive work environment where everyone feels informed and engaged. Remember, communication is key. Thanks for tuning in. Let's continue to support each other and thrive as a team. Let's move on to the next segment. Hello BZBs, welcome to our video on scheduling policies here at ICANN. Whether you're a behavior technician or a member of our dedicated staff, understanding these policies is crucial for providing the best support to our clients. Today, we'll walk you through our availability and cancellation policies. Let's get started! First up, let's talk about our availability policy. Our scheduling department conducts 3 annual check-ins to ensure your availability remains consistent. Here's how it works. Now, remember, once you submit your availability, changes won't be approved until the next check-in date. It's important to think about your current client schedules when confirming your availability. Important note for district staff. Morning availability applies for the entire school year. No changes can be made due to your commitment. Alright, what if you need to change your availability? Don't worry, we got a simple process for that. To request a change, email the clinical director, your scheduling supervisor, your assigned scheduler. Be sure to include your requested changes and reasons. Please allow up to 1 week for your request to be reviewed. Note that if your changes impact the current client schedule, they may not be approved immediately. Next, let's discuss the cancellation policy. As an ICME employee, punctuality is crucial. Unplanned absences can disrupt not only your work, but also the support provided to our clients. For planned absences less than 2 weeks, send an email to your team members, including details about your absence and identifying coverage. For planned absences more than 2 weeks, fill out a TRO form and email it to your supervisor. If you don't hear back in 72 hours, follow up. For unplanned absences less than 12 hours, notify the family immediately and send a cancellation email to your team. The cancellation protocols prior to BT arrival. First things first, if a member of the clinic or admin team receives a notification about a cancellation, they'll promptly notify you via email. But what happens if the family reaches out directly? Here's what you need to do. If a family contacts you to cancel a session, your immediate responsibility is to email the following team members: the cancellations team at cancellations@ikmb.com, your assigned scheduler, the client's case manager, and the client's BCBA supervisor. Don't forget to include details such as which client canceled, when the cancellation took place, and the reason for the cancellation. Next, remember to coordinate makeup time during your next visit to the home. Once you've confirmed the time, send an email to everyone on the list letting them know when the makeup session will occur. Now let's talk about cancellations that happen at the door or the family requests an early dismissal. If a family cancels at the door, send a notification email detailing the cancellation and the reason to your team. Include the same list of team members as before and ensure your email gets to the cancellation team. If a session ends early, update the time on your CR. Make sure it's only for that single appointment and notify your team about the new end time and reason for the early dismissal. Client no-shows are a little different. If a client isn't present at the scheduled start time, reach out to the family via call or text. Here's a rule of thumb: wait until the scheduled start time before contacting them if you arrive early. If you don't get a response, leave a voicemail mentioning you'll wait 15 minutes before leaving. If the family indicates the client's on the way, let them know you'll wait a maximum of 30 minutes. If they still don't arrive, follow the cancellation protocol by notifying your team. If you arrive at school and the client isn't there, check in with the school receptionist to confirm the client's arrival. If they won't be attending, follow the same cancellation protocol. Now let's quickly cover the cancellation reimbursement policy. For a client no-show, if the client doesn't show up within 15 to 30 minutes, you'll be compensated 50% of the session at your direct rate. For example, if you're scheduled for a 2-hour session but the guardian ends it within half an hour, you'll be compensated for 1 hour. However, if the session ends after an hour or more, you'll only be paid for the actual time spent with the client. Alright BZBs, thank you for tuning in. Remember, communication is key when handling cancellations. Welcome to our training session on drive time and mileage policies. Today we'll cover everything you need to know to ensure you're reimbursed fairly for your travel time and mileage. Let's dive right in. First up is the drive time policy. So, when is drive time applicable? Drive time comes into play when you need the full time to travel from one work appointment to another. Now, who's responsible for adding drive time to your schedule? The scheduling team handles this. If you notice drive time is missing from your calendar, don't hesitate. Reach out to your assigned scheduler and the scheduling supervisor for support. So, who converts drive time when it's added? That's right, staff are responsible for converting their own drive time. However, remember, Only convert drive time when applicable. If there are cancellations or changes to your schedule that mean you no longer qualify for drive time, please leave that appointment unconverted. Next, let's talk about the mileage policy. The current rate is 75 cents per mile. So, when do you apply mileage? Mileage is applicable in between any work appointments, regardless of how much time has passed. For example, if you have session A from 10 a.m. to 12 p.m. and session B from 6 p.m. to 8 p.m., you'll need to add mileage from session A to session B during conversion. So, who adds the mileage? Both behavior technicians and case managers must add mileage to the second appointment. For instance, if you traveled 13 miles from session A to session B, you'll enter the 13 into the mileage box on your session B appointment during conversion. And that's it! Understanding these policies ensures you're fully compensated for your time and travel. If you have any questions or need assistance, remember, you can always reach out to your scheduling team. Thank you for watching, drive safe, and keep up the great work! Hey everyone, welcome back to Quiz Time. We have some crucial questions regarding session cancellations and scheduling. Are you ready to play? Let's dive right in. Alright, here's your first question. When canceling a session, who should you contact? A. Assigned scheduler. B. Case manager or BCBA. C. Cancellations department. D. Team members. Or E. All of the above. And the correct answer is E, all of the above. That's right. To ensure everything runs smoothly, it's essential to contact all relevant parties when canceling a session. Teamwork makes the dream work, right? Let's move on to question 2. How many times per year does scheduling request an update availability? Is it A, 4, B, 1, C, 3, or D, 2? Think you know the answer? If you guess C, 3 times a year, you're correct! Scheduling will reach out for your update availability 3 times a year to keep everything on track and organized. Great job, everyone! Remember, when it comes to managing sessions, communication and timely updates are key. Keep those contacts fresh and stay aware of your scheduling updates. Thanks for playing Quiz Time! Hello, iCanBe team. Welcome back to our Employee Resource Series. Today, we're diving into a very important topic. The time off request policy. Whether you're a behavior technician, case manager, BCBA, or administrative staff, this video has you covered on everything you need to know for a time request. First things first, before taking any type of leave, all team members at iCanBe are required to complete a time off request form. It's important to know that iCanBe does not pay employees, whether exempt or non-exempt, during their requested time off. For our exempt salary employees, any deductions will be made to the days not worked during these periods. This is calculated based on your regular hours. 8 hours per day or 40 hours per week. So keep that in mind when planning your time off. Now let's talk about the types of time off requests you can make. 1. Single day time off request. You must submit this request 2 weeks in advance. You're allowed to request a single day off a maximum of 3 times per year. 2. Extended time off requests. For any requests that are more than 2 days, you need to submit in 2 months in advance. 2. Extended time off requests. For any requests that are more than 2 days, you need to submit in 2 months in advance. You can make this type of request up to 2 times per year. Remember, if you try to submit a request after the deadline, it may be denied unless for medical reasons or bereavement. And if that happens, you'll have to follow with the time off request protocol. Once you filled out your form, here's what you need to do based on your role. Behavior technicians, email your completed form to tro@icanbe.com. The scheduling department will respond within 72 hours or 3 business days. Case managers, send your form to both tro@icanbe.com and your assigned regional director. Your supervisor will get back to you within 72 hours or 3 business days. BCBAs and directors, the process is similar. Email your form to tro@icanbe.com and your assigned supervisor. Again, expect a response within 72 hours or 3 business days. If you're requesting time off that may be considered a leave of absence, make sure you also email hr@icanbe.com alongside the time off request email. Allow up to 72 hours or 3 business days for HR to respond with the next steps. And remember, if you don't hear back, don't hesitate to follow up or call your regional office for an update. Now it's quiz time! True or false? Staff should fill out a TRO form for absences that are more than 2 weeks in advance. If you answer true, you're right! Staff should submit a TRO form requesting time off for days that are more than 2 weeks away. Thank you for tuning into this important update on your time off request policy. If you have any more questions, feel free to reach out or consult the employee handbook. Enjoy your time off and take care of yourselves. iCanBe team! Welcome to our sick policy overview. Today we'll be discussing how our sick time policy works, important procedures to follow, and how we prioritize the health of both our employees and clients. Hi everyone, we know that sometimes life happens, and it's important to make the necessary time to recover. Our sick policy ensures you can take care of yourself while also keeping our clients safe. Let's break down the key points. 48 hours of sick time per year. However, please note that you can only use a maximum of 3 days or 24 hours in any given year. If you or a client experience any of the following symptoms 24 hours prior to a scheduled session, please cancel your appointment. As a reminder, if you're out for 3 or more consecutive days, you'll need to provide a doctor's note before returning to the field. Now, let's talk about how to formally request your sick time. Step 1. After following the cancellation protocol, email payroll@iknbe.com. Step 2. Provide the reason for your request. No detailed information is necessary. Step 3. If you're requesting 2 or more sick days, a doctor's note or a COVID test result may be required. This example shows how to format your sick time request clearly. Important note for our team members. If you are a behavior technician, the scheduling team will cancel your appointments in our system, labeling them as provider illness. For admins, case managers, BCBAs, and directors, please cancel your own appointments with the same label. It's crucial to label these appointments correctly. Our payroll department will cross-reference your email requests with these cancellations to ensure everything is in order. Finally, expect a response from payroll within 3 to 5 business days to confirm if your sick time will be applied or if you do not qualify. Thank you for watching our sick policy overview. Your help matters to us, and following these guidelines ensures everyone stays safe and informed. If you have any questions, don't hesitate to reach out. Welcome everyone. Today we'll discuss important general safety protocols we have in place for providing in-home services. Your safety and that of our staff and clients is our top priority. Let's dive in. First, let's talk about face masks. Currently, staff are not required to wear face masks when providing in-home services. However, our school-based staff will continue to follow the specific guidelines set by their district. For parents, guardians, and other household members present during these sessions, wearing a face mask or covering it is also not mandatory. We understand that everyone's comfort level varies. Nevertheless, we encourage parents and guardians to limit the number of people present during sessions. This helps facilitate social distancing whenever possible, providing a safer and more comfortable environment for everyone. Now let's talk about hygiene. It's essential that our staff members have the opportunity to wash their hands as soon as they arrive at the client's home during sessions and at the end of their time there. Hand hygiene remains a crucial part of our protocols. If a staff member finds a challenge to distance themselves from a client during a session, we have a solution. They can contact the HR team and request disposable gloves for the sessions. This ensures safety while maintaining engagement. Another important point is regarding toys, stimuli, and items used during sessions. To minimize risk, these items should not be shared across different clients. If sharing is unavoidable, our staff members must take necessary steps to disinfect those items thoroughly. We recommend using items that are already available in the home or keeping separate materials for each client. In conclusion, by following these general safety protocols, we can ensure a safe and productive environment for both our staff and clients. Thank you for your cooperation in creating a safe space for everyone involved. If you have any questions, please don't hesitate to reach out. Stay safe and take care. Welcome to an informative session on breaks and mealtime policy here at ICNB. Understanding your rights and responsibilities regarding breaks and meal periods is vital for maintaining a productive and healthy work environment. Let's start with the rest break policy. If your work sessions last over 4 hours, you're entitled to paid break of 10 minutes. And for those working longer than 8 hours, you'll receive 2 10-minute breaks. However, there may be times when practical considerations prevent these breaks from happening on schedule. For example, if you're providing essential support to a client. You'll be informed by your supervisor if any adjustments are made. Now let's talk about your lunch breaks. If you work for more than 5 hours in a day, you'll be entitled to an uninterrupted, unpaid meal period for at least 30 minutes. Remember, you must clock out for your meal period if required. But if your total work period is more than 5 hours but no longer than 6, you may choose to waive this break. To do this, simply reach out to Human Resources for an on-duty meal waiver form. Before we wrap up, here are a couple key reminders. Rest and lunch breaks will not appear on your schedule, so be sure to plan ahead. At ICNB, we value your time and well-being. Taking breaks and meal periods not only helps you recharge, but also enhances productivity and teamwork. Thank you for being part of this community. If you have any questions regarding our breaks and mealtime policy, don't hesitate to reach out to your supervisor or Human Resources. Welcome to ICNB's Employees Resource Guide. Today, we're diving into an essential topic, leave of absence. Our goal is to ensure you understand your rights and responsibilities when it comes to taking time off for jury duty, medical leaves, family matters, and more. Let's start with jury duty. At ICANN, we encourage all employees to fulfill their civic responsibilities. If you're called to serve, here's what you need to know. Next, let's discuss extended medical leave of absence. This is available for non-work related medical conditions with a doctor's certification. Don't forget, you must present a doctor's certificate stating you're fit to return when coming back from medical leave. Now let's touch on family and medical leave, or FMLA. Under state and federal laws, you may take up to 12 work weeks of unpaid leave per 12-month period if you meet the following criteria. FMLA can cover various needs, including serious health conditions or family care responsibilities.
What's FMLA? FMLA stands for Family and Medical Leave Act. It's a federal labor law passed in 1993 that entitles eligible employees to take unpaid protected leave for family and medical reasons while continuing group health insurance. Its purpose? To help professionals balance the demands of work life and family life. Basically, FMLA provides eligible employees with 12 weeks of unpaid leave each calendar year without threat of losing their job. It also requires that employers maintain health benefits as if the employee is still working there. And the cherry on top? FMLA ensures that employees can return to work without risk of firing or demotion. Eligible employees are able to take 12 weeks within a 12-month period for circumstances including the birth of a child, child care within the first year of birth, spousal care, child care, or parental care for a relative with a serious health condition, a serious health condition that prevents the employee from performing the essential functions of her job. FMLA exists in order to provide families the space that they need in order to care about their loved ones without agonizing over what's happening with their job security. Certain situations qualify for FMLA. The employee has a serious medical condition. The employee must care for immediate family with a serious medical condition, pregnancy, the birth and care of a newborn, placement or subsequent care of an adopted or foster care child, care of an injured service member. If your family member is a service member in the armed forces, there's additional coverage for care available. Covered service member is a current member of the armed forces. Care under FMLA for a covered service member includes a service member receiving medical treatment, recuperating from a medical treatment or injury with outpatient status, or a service member on the temporary disability retired list for a serious injury or illness. To see if you're eligible for FMLA, check with your employer, your HR department, or your state laws. To get started, check out our article on FMLA. We've laid out eligibility step by step and compiled a list of resources to help you get started.
For those expecting, ICANN understands the need for pregnancy disability leave. You can take up to 4 months depending on your physician's advice. ICANN also supports lactating employees. We provide reasonable break times for express breast milk. Here's what to remember. Other important leaves include military leave and bereavement leave. For military leave, necessary documentation must support your time off. In the case of bereavement, ICANN allows up to 5 days off for the passing of close family members. Remember, you can reach out to Director of Operations for any additional needs or accommodations. We understand that these are sensitive times and we're here to support you. Thank you for joining us today in reviewing ICANN's leave of absence policy. We hope this information helps you navigate your time off with greater confidence. If you have questions, don't hesitate to reach out to HR or your supervisor. Take care. Remember, we're here to support you every step of the way. Once you're ready to return, let's talk about reinstatement. If your leave was for medical condition, you'll need to present written documentation that you're cleared to return to work. Under most circumstances, when you return from family or medical leave, you will be reinstated to your original job or to an equivalent job with similar pay, benefits, and working conditions. Everyone deserves a fair chance to get back to work. However, it's important to understand that your right to reinstatement does not exceed what you would have if you had been continuously employed. For instance, if a layoff would have occurred or if your position is eliminated while you were on leave, you may not be entitled to that same position. And remember, your use of family or medical leave won't cause you to lose any employment benefits you've earned prior to your leave. Your contributions to the workplace count, and they still matter. So whether you're dealing with a health issue, welcoming a new family member, or just need some personal time, know that the process is designed to protect your rights as an employee. For more information or if you have any questions, don't hesitate to contact your HR department. They're here to help navigate through this process. Thank you for watching, take care, and we wish you the best with your leave of absence. Welcome to our I Can Be informational series. Today we're going to discuss an important topic, workers' compensation. Let's dive into what benefits you may be eligible for if you experience a work-related injury. At I Can Be, in accordance with state law, we provide insurance coverage for employees who face work-related injuries. The benefits may include medical care, coverage for necessary medical treatments, cash benefits, tax-free compensation to help replace lost wages, return to work assistance, support for qualifying injured employees aiming to return to suitable employment. Now, it's crucial to understand the steps to ensure you receive these benefits. First and foremost, you must report any work-related injury immediately to Human Resources and the regional director. Remember, this should be done within 30 days of the injury. Make sure to fill out an I Can Be incident form. If medical treatment is required, contact the triage line for guidance on where to seek help. Finally, complete all necessary paperwork and return it to Human Resources. Incident reports play a vital role in our process. When filling one out, provide as much detail as possible. Submit it to HR and your clinical team within 24 hours of the incident. It's important that all I Can Be employees fill out an incident report if situations like client injuries, staff injuries, mandatory report instances, inappropriate interactions, and more. Let's move on to payroll policies. Pay days for I Can Be are on the 6th and 20th of each month. If a payday falls on a weekend or holiday, the payment will be processed on the next business day. Work completed from the 1st to the 15th gets paid on the 20th. Work from the 16th to the end of the month will be paid on the 6th of the following month. So, how do you get paid for your work? First, convert your work appointments into timesheets daily. Here's how. Log into CentralReach using your username and password. Click on the calendar icon, then select View My Calendar. Find the appointment you want to convert using the lightning bolt. If applicable, gather signatures for mileage. Finally, submit the timesheets to convert it. Remember to check your pay rate or rates on your QuickBooks portal. If you notice any discrepancies while converting your timesheets, email payroll@icanbe.com. And don't forget to attach a screenshot of the error. The team is also available on Workplace. Hello I Can Be team, welcome to our payroll FAQ session. We know navigating payroll can be a bit tricky, especially when you're new to the organization. But don't worry, we're here to help clarify everything you need to know about converting your appointments and getting reimbursed for your hard work. First up, why do you need to convert your appointments? Here's the deal. I Can Be will only reimburse work appointments that have been completed and converted into timesheets, so making this conversion is absolutely essential. Now, let's talk about how to make sure you receive proper reimbursement for your work. The answer is simple. Convert all your work appointments into the timesheets in a timely manner, ideally every day. Also, take a moment to review your timesheets. Make sure all your work hours are inputted and accounted for correctly. You can easily access your timesheets by clicking the $ icon located at the top of your CentralReach account. Remember, while CentralReach does house pay rates, these are updated monthly. QuickBooks primarily handles the correct pay rate based on your work hours. So trust that your pay rate there is correct. Now, what if you encounter an error while converting your timesheets? No problem. Just email the scheduling department and our wonderful team member at payroll@icanbe.com. Make sure to attach a video or picture of the error message to expedite the process. You can also reach out to us via Workplace for assistance. What if you didn't convert your appointment on time? If this happens, simply send an email to payroll@icanbe.com, claims@icanbe.com, your scheduling department if you're a BT, and your direct supervisor. Remember, all parties must be included in the email. But don't stress too much. You will still be reimbursed in the next pay cycle as long as the hours are converted, even if it's late. Are you conducting telehealth sessions having trouble getting signatures? If you find yourself in this situation, reach out to the scheduling department. They will help you through the process. Just a heads up, this applies solely to BTs. Now, if you're new at I Can Be and haven't received your pay via direct deposit, let's clarify some reasons why. If you provided your direct deposit information during the hiring process, you should get paid immediately. However, issues could arise if you're not HR cleared, if the direct deposit information is incorrect, or if you're opted for a paper check, which takes an additional 3 to 5 days due to mailing. Let's make one thing clear. To be paid on time for your services, you must convert your sessions daily. If you're unable to, reach out to Becky at ocscheduler@icanbe.com, Diana at dbonilla@icanbe.com, or Lindy at claims@icanbe.com right away. Remember, failing to convert your sessions can result in inaccurate pay, delayed payroll, loss of bonus opportunities, and even disciplinary actions if it becomes a recurring issue. To wrap up, always check your pay stubs on the QB portal to ensure everything's accurate. We're all in this together. We want to make sure you get paid correctly and on time for all your hard work. If you have any further questions, don't hesitate to reach out. Thank you for being part of the iCanB team, and keep up the fantastic work. Welcome to Money Talks, where we break down the essential rates and qualifications that can positively impact your paycheck as a clinician. Today, we're diving into district coverage rates, holiday pay, weekend rates, social skill rates, and administration work, so stay tuned. First up, let's talk about district coverage rates. So, who qualifies for these rates? CMs and BTs, only those not scheduled to provide services that day. That means that if you're assigned to cover a case because your client canceled, unfortunately, you do not qualify for the coverage rate. If you do need to provide coverage, be sure to reach out to Diana Bonilla via email or workplace chat. Now, how much extra are we looking at? You'll be receiving an additional $2 added to your district or clinical rate. Next, it's time to discuss holiday rates. So, how much do you get paid? You earn an additional $5 added to your clinical rate if you perform billable work on a holiday. Who qualifies? Any clinician that performs billable work on those special days. Let's move on to weekend rates. Who qualifies for this? Anyone who performs client-facing work. Note, inter-work work does not count. And how much will you earn? That's an additional $2 to your clinical rate. But remember, this does not include social skill sessions. Now, on to social skill rates. Here's a breakdown. 1-to-1 weekend clinical home rate. 2-to-1 sessions, $30 per hour. 3+ 1-to-1 weekend clinical home rate. 2-to-1 sessions is $30 per hour. 3 or more clients is $35 per hour. Who qualifies for these rates? BTs that sign up for social skill sessions. Just keep in mind, these rates are subject to change based on our client count. Lastly, let's discuss administration rates. What is considered admin work? Meetings with CM, BCB outside of scheduled 1-to-1 sessions, meeting with the regional director or admin team, trainings, office work, drive time. So what is the admin rate? Well, admin vary among employees. It's typically set at the minimum wage. And that's a wrap on today's episode of Money Talks. We hope this information helps you navigate your rates and qualifications effectively. Be sure to reach out to your supervisors if you have any questions. Until next time, manage your money wisely. Whether you're feeling under the weather or caring for a loved one, understanding your sick pay can make all the difference. So, how many sick hours do you receive? Well, employees can accrue up to 40 hours each year. And here's the good news. Any sick hours you haven't used from previous years will roll over. Remember, they cap at 48 hours. That means your health and well-being are always a priority here. Now, who qualifies for sick pay? The answer is simple. All employees, all BZBs. Yes, you heard it right. Now that you know you qualify, let's talk about how to request your sick hours. To request sick hours, just email payroll and HR. Be sure to include the name of the client, the total session hours, and the amount of sick hours you want to apply. Here's an example. MCAR 12/16/23, 4 hours. It's that easy. Now you might be wondering, how much am I getting paid when I use sick time? Well, sick pay will be compensated at your clinical rate. Now let's discuss when you can actually use your sick time. You can utilize your sick time when you're scheduled for a session but have to cancel due to being sick, or someone in your immediate family is unwell. It's all about making sure you and your loved ones stay healthy. Next up, let's touch on the admin appointments. In case you didn't know, admin appointments are added to your schedule once you begin working with clients. Time is added based on the direct hours you work in the following increments per pay period. Less than 10 hours, 15 minutes. 10 to 20 hours, 30 minutes. 20 to 30 hours, 45 minutes. 30 plus hours, 1 hour. And don't forget about HR policies, which include mandated reporting. Let's take a look.
Counties in California received 167,740 calls for suspected child abuse just from April through August 2019. California businesses with any contact with minors have new legal requirements they must maintain to remain compliant and protect employees. Employers that fail to meet these new guidelines face penalties and even prison time. Assembly Bill 1963 took effect January 1, 2021, so businesses subject to AB 1963 are required to begin this training now. Mandated reporters are people in contact with minors that are legally required to provide a report to law enforcement or a social agency when abuse is observed or suspected. Failure to report this specified conduct is a crime. Mandated reporters are legally responsible to report the incident themselves but not required to investigate. All persons who report child abuse or neglect may remain anonymous except a mandated reporter. Mandated reporters must provide their names but will receive immunity from civil liability. Assembly Bill 1963 modifies and expands the list of mandated reporters to the existing law, the Child Abuse and Neglect Reporting Act. The following employers and employees are designated as mandated reporters. Human resource employees of businesses that have 5 or more employees that also employ minors. Frontline supervisors for businesses with 5 or more employees that have direct contact with minors are mandated reporters for sexual abuse only. Employees of a private or public school, including teachers, teachers' aides or assistants, and administrators of a post-secondary educational institution in contact with minors. Employees of county or state offices of education who have regular contact with children while performing their work. State diagnostic centers and special schools that are managed by the State Department of Education and charter schools. Athletic coaches, administrators, and directors employed by any public or private school for kindergarten through grades 12. Employees in institutions such as a child daycare group home or residential care facility, and administrators and licensees of such organizations. Administrator, presenter, or counselor in a child abuse prevention program. Employees of any police department, county sheriff's department, county probation or welfare department such as security, parole, and probation officers. Firefighters, however, volunteer firefighters are excluded. District attorney examiners or child support company employees, unless working with an attorney assigned to the Welfare and Institutions Code in representing a minor. Workers in the medical field such as a surgeon, dentist, resident, intern, chiropractor, licensed nurse, dental hygienist, paramedic, or optometrist. Public health employees who treat minors for venereal disease or other conditions. A coroner, medical examiner, or anyone who performs autopsies. Therapists such as a professional clinical counselor, associate, or trainee, marriage and family therapists, psychiatrists, psychologists, and their assistants. A drug and alcohol counselor. Alcohol or drug abuse is not by itself a basis for reporting child abuse or neglect. A commercial film and photographic print processor excluding companies that develop for public agencies. Commercial computer technicians involved with implementing procedures to report illegal materials. State social and public assistance workers, autism service providers, and an employee or volunteer of a court-appointed special advocate program. A child visitation monitor of a visit between a child and another person ordered by a court of law. An individual certified by a licensed foster family agency or approved as a resource family. Administrators or employees of a public or private day camp or employees of a youth center organization. An animal control officer or humane society officer. A clergy member or religious practitioner such as a priest, minister, or rabbi. Any custodian of records for a clergy member. Clergy members acquiring knowledge of child abuse during a meeting in confidence or penitential communication has a duty to keep those communications secret. Identification of warning signs is crucial in interpreting abuse. These range in clues from the parent or caregiver, their home environment, physical evidence of abuse, and behaviors of the child. Clues from the parent can include descriptions of implements to discipline the child, indifference to the child, and an inability to provide a safe environment. Environmental indicators may be descriptions of unsanitary conditions at home and dangerous conditions, such as faulty home electrical wiring. Physical injuries can include visible unexplained bruises, burns, a black eye, swollen lips, or fractures. Behavioral signs from the child that may be the result of abuse can include self-imposed isolation, destructiveness, putting themselves down, and being verbally abusive, dirty, or unkempt. These cues are not guarantees of abuse. The organization needs to be aware of these situations to make proper inquiries to attain more information. Mandated reporters are not required to investigate or collect information for proof. Only a designee by the county or child protective agency may perform an investigation. However, mandated reporters may assess the situation by observing nonverbal communication, injuries, and asking questions and listening to potential victims. Encourage those you suspect of being abused to trust you with any concerns. Breed an environment of trust and inclusion to encourage sharing. Examples of incidents a mandated reporter must report include physical abuse, sexual abuse, willful cruelty, unlawful corporal punishment, neglect. Incidents do not include public fighting between minors, reasonable and necessary force by a police officer, a homeless child or unaccompanied youth, reasonable age-appropriate spanking without risk or injury to the child. Training must include identifying and reporting child abuse, sexual abuse, and neglect. Train mandated reporters annually if your organization is a public school. Train every 2 years if your organization is a licensed child care provider. Train mandated reporters of a licensed child daycare or licensee applicant during the first 90 days of employment. If you see it, report it immediately by phone. Within 36 hours of receiving the information, submit a written report sent by fax or electronic submission to a welfare department, police department, or a county probation department. Submit these reports on the Department of Justice Form SS8572, Suspected Child Abuse Report. When more than one person that's required to report child abuse or neglect has knowledge or suspects it has occurred, they can agree on one person to make the report. Mandated reporters failing to report known or suspected child abuse or neglect can receive up to 6 months in county jail, a fine of $1,000, or both. Mandated reporters who intentionally conceal his or her failure to report an occurrence discovered to be child abuse or neglect is considered to be in violation of a continuing offense. No organization wants to be responsible for harm that comes to children. With the proper training, the company can put in place a protocol to make their work environment a respectful place for minors and all employees. Taking the time to prepare employees about what actions to take not only complies with California law, but also protects the children in our communities.
Let's take a quick quiz on mandated reporting. First question, what is a mandated reporter? The answer, a mandated reporter is someone required by law to report suspected child abuse. Now, quick question 2, what are the steps to make a report? Call 911 if a child is in immediate danger. If not, notify the clinical team, HR, RD, BCBA, or CM. 2, call the child helpline to make a report. 3, make a written report within 24 hours. It's crucial that we take all these policies seriously to protect those who need it. Thanks for joining us today. Remember, taking care of yourself is as important as taking care of your clients. If you have more questions about sick pay or HR policies, don't hesitate to reach out. Until next time. First, let's explore the Health Insurance Portability and Accountability Act, commonly known as HIPAA. This federal law protects sensitive patient and health information from being disclosed without the patient's consent.
Healthcare is no stranger to any of us. Whether we are providing it or receiving it, confidentiality is paramount. Fortunately, there is a practice in place to protect us. In 1996, the Health Insurance Portability and Accountability Act was signed into law. The law, more commonly known as HIPAA, protects the privacy of every medical record and strengthens every individual's control of personal health records by giving us greater access to our personal health information and greater control of its use and disclosure. HIPAA has been updated several times over the years, including through the HITECH Act of 2009, which increased penalties for non-compliance and imposed stringent requirements for data breach, and through the final Omnibus Rule of 2013, which strengthened privacy protection to its greatest level yet. HIPAA is a rule that is important to all of us because we all have personal health information. Protecting this information is one of the most important duties of any healthcare professional. Not only because privacy is a sacred right that we all cherish, but also because it is federal law and is therefore mandatory. There are severe civil and criminal penalties for non-compliance. Anyone who obtains or discloses protected health information by deliberate neglect, for personal or commercial financial gain, or for any other malicious purpose may be subject to termination, demotion, suspension, hefty fines, loss of license, or criminal prosecution. Protected health information, also known as PHI, is health information that can be connected to a person. In other words, if any identifying information such as name, address, birth date, or social security number is connected to health information, then it is protected by HIPAA. Covered health information includes past, present, or future health conditions, how the health care was provided, the payment history for the health care, personal information such as name, address, social security number, birth date, and billing information. HIPAA covers the protection of this information when it is used or disclosed orally, written, or printed on paper, and when sent electronically. The best practice when dealing with health information is to automatically assume it is protected by HIPAA until you are told differently by an expert. Organizations covered by HIPAA are called covered entities. A covered entity is essentially any organization or individual who has access to patient records. These include healthcare providers, health plans, healthcare clearinghouses, and business associates. Business associates are organizations or individuals who provide services such as claims processing or legal and consulting services. A business associate is covered by HIPAA if their work involves access to protected health information or the use or disclosure of protected health information. When a covered entity hires a business associate, there must be written safeguards that detail PHI use. The business associate is subject to the same HIPAA rules as any other covered entity and cannot be contractually authorized to violate the rule. How is protected health information protected? In many cases, it requires written authorization from the patient or a patient's family to use or disclose PHI. However, HIPAA was never intended to get in the way of prompt and effective medical care. Consequently, there are several scenarios when this authorization is not required. When treating a patient, the full record of an individual's medical history is needed to provide the best care possible. Therefore, permission is not needed when PHI is accessed by professionals directly involved with the patient's medical care. And can you imagine what a nightmare it would be if healthcare facilities were required to have staff get permission for every action they took? Thankfully, they don't. No permission is needed to use and disclose PHI for healthcare operations and billing. Healthcare workers who receive PHI in these instances should make privacy their paramount concern and do everything in their power to keep the information private. There are some situations, however, where complete privacy is not possible. HIPAA calls this incidental exposure. In these situations, medical professionals should take reasonable care to keep information private. When discussing the treatment and care of a patient, try to avoid public areas like waiting rooms or elevators. If this is not possible, then avoid using the patient's name. If the patient is not in a private room, the curtain should be pulled and a reasonable attempt to not be overheard should be made. For instance, this doctor and nurse are discussing a patient as they walk down the hallway. However, they are taking care not to mention the patient's name, and the hallway is not busy. They have minimized incidental exposure and are not in violation of HIPAA. When using PHI, healthcare workers should use the minimum amount of information necessary to get the job done. HIPAA calls this the minimum necessary rule. The doctors and nurses directly involved with the treatment of a patient need all of the medical history available for effective medical care. However, other workers involved in the care, such as lab technicians, need a much smaller amount of the patient's personal health information. Covered entities need to establish policies and procedures that restrict the access and use of PHI to the minimum necessary. Employees who regularly access PHI need to be categorized by the type of PHI they need and the conditions for their access, so that only the amount of information they need to do their job effectively is released. In addition to patient treatment, operations, and billing, there are several other scenarios where no permission is needed to release the minimum necessary PHI. These include for public health activities related to disease prevention and control, to report victims of abuse, neglect, or domestic violence, for audits, legal investigations, licensure, law enforcement purposes, and government functions, for coroners, medical examiners, funeral directors, tissue organ donations, and certain research purposes, when requested by employers for a work-related illness, injury, or medical surveillance to comply with OSHA, MSHA, or a similar state law, to avert a serious threat to health and safety, and as a limited data set where all personal identifiers have been stripped out. Finally, minimum necessary PHI can be used or disclosed without authorization, but with patient agreement to maintain a patient directory, to inform family members about care, location, condition, or death, and inform agencies during disaster relief. This can be accomplished by getting simple verbal consent from the patient. In emergencies, when the patient is incapacitated or otherwise unable to consent, you will have to rely on your professional judgment to determine what is in the best interest of the patient. For example, it is usually permissible to release information on the patient's progress to family or friends who accompanied the patient to the hospital. However, if a family member arrives after the patient has been admitted, it is important to check identification and to review the facts of the case before proceeding, especially if there is evidence of domestic violence or abuse. Let's look at some scenarios that could occur in a healthcare environment. This doctor is relaying test results to a patient's spouse. However, he is giving the information in a waiting room where he can be overheard. In addition, he has failed to get agreement to share this information from the patient. Both acts are a violation of HIPAA privacy. Remember, when giving PHI to a family member, first make sure that you receive approval from the patient to release the information. Then make sure that you give the information in the most private manner available, preferably in a private room or in a private area where you cannot be overheard. This doctor is giving information about a patient's status to several family members. The patient is incapacitated and cannot give permission. However, the family members shown brought the patient to the hospital. The physician has used his professional judgment that releasing the patient's PHI is in the patient's best interest. He has also taken care to bring the family members into a private room. So what about telephone calls to patients? HIPAA allows for healthcare providers to communicate with patients by phone or mail. When leaving a message on an answering machine or with a family member or other person when the patient is not home, take care to leave the minimum amount of information necessary. For example, leave only your organization name and phone number and ask for a callback, or leave the minimum amount of information necessary to confirm an appointment. For all other uses of PHI,
HIPAA ensures that your health data remains confidential. It mandates that healthcare professionals securely handle any personal health information and provides patients with rights regarding their data.
The Department of Justice has zero tolerance for workplace harassment. Since some of you still seem to be confused about what harassment is, I'll define it for you, and at the end of this video, I'll give you professional, award-winning advice, so stick around. Harassment is conduct that is based upon an employee's race, color, national origin, sex, age, sexual orientation, disability, gender identity, protected genetic information, pregnancy status as a parent, marital status, political affiliation, or any other non-merit-based factor. In order to be harassment, that conduct has to affect an individual's employment, unreasonably interfere with an individual's work performance, and/or create an intimidating, hostile, or offensive work environment. Breaking news, we have just learned that when someone takes credit for your work, it's called psychological harassment. You're welcome. Who commits harassment? Harassers can be supervisors, coworkers, contractors. Anyone can be a harasser. People who are protected from discrimination by law do not get a free pass to harass other people. Doesn't work that way. On that note, anyone can be a victim of harassment. A victim of harassment doesn't even have to be the person who's being harassed. Anyone can be affected by an offensive work environment, kind of like secondhand smoke, and you don't want the smoke. Harassment can include jokes, slurs, epithets, and name-calling, which is pretty self-explanatory, intimidation, insults, or threats, physical or violent confrontations, better sit on them hands instead of throwing them, offensive objects or pictures in the workplace. It's best to leave your porn at home. Inappropriate conduct outside the workplace that adversely affects others in the department or its mission. Common decency and workplace policies don't magically disappear when you go outside the fence. Conduct through electronic means such as sending offensive or repetitive emails or texts, or offensive use of social media. Those passive-aggressive TikToks that you make about an unnamed coworker aren't fooling anyone. If you see something, say something. Workplace harassment undermines the mission of the Department of Justice, and employees who are aware of harassing behavior or are being harassed should report it to their supervisor. Unless your supervisor is the harasser, and then you would report it to their supervisor. Okay, this just in, a source from central office is telling us that just because someone doesn't like you doesn't mean they are racist, sexist, homophobic, transphobic, or a political extremist. The source claims that in an overwhelming number of investigations, the plaintiff is just an unlikable person. We can confirm that there is nothing in policy to support the notion that just because someone doesn't like you, there is something wrong with them. Time for that award-winning advice. It's 2023 and everything under the goddamn sun is offensive to someone, even this video. The best way to avoid being accused of harassment is to just keep your mouth shut and do your job. But even that isn't a guarantee if your face is offensive, which it probably is.
Next, let's discuss our anti-harassment policies. At iCanBe, we have zero tolerance approach to harassment. This policy applies to everyone involved in operations, including employees, supervisors, vendors, and clients. Harassment, disrespectful, or unprofessional conduct will not be tolerated. If you witness or experience harassment, it's crucial to report it to your supervisor or HR immediately. Now, let's cover the topic of dual relationships. These can create conflict of interest and lead to potentially harmful situations. As behavior analysts, we avoid multiple relationships that could impair our judgment. If you find yourself in such a situation, it's vital that you inform your supervisor immediately. Remember, we do not accept gifts from clients, and we maintain professional boundaries to protect our relationships. Equally important is understanding exploited relationships. At ICANN, we do not engage in relationships with clients, students, or supervisees that could compromise our professional integrity. Our commitment is to ensure a safe and ethical environment. We do not have sexual relationships with clients or students, and we maintain a 2-year buffer after a professional relationship ends. Thank you for watching. Stay informed, stay respectful, and let's continue to make ICANN a great place to work. Welcome to ICANN's essential video on our non-discrimination and anti-retaliation policies. Here at ICANN, we believe that every employee and applicant deserves a workplace where they are treated with respect and equality.
Illegal workplace discrimination causes people to be treated unfairly because of their race, color, sex, age, disability, religion, or national origin, among other characteristics. Discrimination affects not just the individual, but families and entire communities. It's everywhere. Fortunately, efforts to reduce its spread continue to gain momentum. Over the years, several federal laws have been passed to prevent illegal discrimination and to protect people's rights. The U.S. Equal Employment Opportunity Commission, EEOC, enforces many of these federal laws. Here's a quick look at some of them. Title VII of the Civil Rights Act of 1964 prohibits discrimination on the basis of race, color, religion, sex, and national origin. The Equal Pay Act protects employees from wage-based sex discrimination. It requires that men and women be given equal pay for equal work. The Age Discrimination in Employment Act makes it illegal for employers to discriminate against anyone over the age of 40 years. The Americans with Disabilities Act prohibits discrimination based on actual or perceived disability. The Family and Medical Leave Act allows employees to take reasonable unpaid leave for certain family and medical reasons. The Uniformed Services Employment and Reemployment Rights Act protects the job rights of individuals who undertake military or disaster relief service. It also prohibits discrimination against members of the uniformed services. The Genetic Information Non-Discrimination Act protects individuals from genetic discrimination in health insurance and employment. It prohibits employers from using an individual's genetic information when making decisions about hiring, firing, job placement, or promotion. These federal laws have been passed to prevent illegal discrimination and protect people's rights.
Our commitment to equal employment opportunities is unwavering. We proudly adhere to all applicable laws that prohibit unlawful discrimination against anyone involved in operations, whether you're a job applicant, an employer, or an unpaid intern. ICANN has a strict anti-discrimination policy in place. Discrimination based on sex, race, or ethnicity for employees performing similar work is not tolerated. Our commitment extends to ensuring fair pay practices as outlined in the California Fair Pay Act and federal law. We understand that conversations around wages can be sensitive. Rest assured, you will not face retaliation for discussing or inquiring about salaries. However, ICANN is not obligated to disclose specific wages of other employees. Our anti-retaliation policy ensures that no one will face retaliation for filing a complaint or participating in any workplace investigation. We pride ourselves on a respectful environment where every employee feels safe voicing their concerns. Discrimination can also occur when reasonable accommodations are not made. At ICANN, we will work to accommodate the religious practices or known disabilities of our employees, provided that it does not cause undue hardship. Together, we engage in a process to identify accommodations that help you perform to the best of your abilities. If you need accommodations, please contact a representative with personnel responsibilities. ICANN ensures that every request is taken seriously and evaluated thoroughly. If you face harassment, discrimination, or retaliation, we encourage you to report it immediately. You can approach your supervisor, our Director of Operations Juan Davila, Regional Director, or Human Resources. Please provide as many details as possible about the incident, including names and any witnesses. ICANN is dedicated to addressing complaints timely and maintaining confidentiality whenever possible. All complaints will be responded to with care. They will be investigated impartially, documented and tracked for progress, and closed swiftly. If misconduct is determined, appropriate action will be taken to ensure it doesn't occur again, and individuals involved may face disciplinary actions, including termination. At ICANN, we value your voice. Every week, we'll be posting a staff survey on Workplace to gather your opinions on how we can improve. These surveys provide insights into our workplace environment and help management understand what works and what can be improved. Your feedback matters. Speaking of Workplace, it's our exclusive social media platform for connecting with your colleagues. Use it to communicate, stay updated, and participate in company events. At iCanBe, we're a united team dedicated to fostering our workplace that champions diversity, equality, and inclusion. Thank you for being part of this journey. Together, let's make iCanBe a model of respect and fairness.